Did you know that you're far more likely to die from cancer in Europe than you are in the United States? Weird, right? However, due to all the cuts that Trump is making, that's probably about to change. Since the early 90s, cancer mortality rates in Europe have been way higher than here in the United States. However, in the United States, you're actually more likely to get cancer than in Europe, okay? In Europe, you have a 28% chance of getting cancer before the age of 75. However, you have an 11.5% chance of dying from it versus the United States, where you have a 34.3% chance of getting cancer before the age of 75. However, you actually have a much greater chance of survival at 8.8%, right? So there's actually four main reasons why this is happening. Number one is age, okay? So Europe just has a larger elderly population, all right? And cancer is essentially a disease of the elderly. 60% of cancer cases are diagnosed in people over the age of 65, right? Around 19% of Europe is over the age of 65, whereas here in the United States, it's around 15%. So the second reason is, okay, this is kind of obvious too, smoking. Europeans smoke a lot more, right? There was a recent survey that found that 25% of people in the EU said that they smoked at least occasionally, whereas in the United States, it was only 14% of US adults. The third reason that the US has better cancer survival rates is because we have Medicare. Seriously. So Medicare is pretty generous, and it's basically to anyone over the age of 65. And this has a lot of other effects. Our Medicare provides an extra layer of financial help for the poor, but that also has a huge influence on how hospitals and other healthcare providers actually do their work, okay? In contrast, right, other high-performing countries in the EU, like Italy, they have regional administration of healthcare systems where the quality of care really depends on where you live, right? It's way better in some places, way worse in others. And the US can use Medicare as a way to enforce these nationwide standards, okay? And even though healthcare is extremely expensive here in the United States, even with Medicare, that Medicare coverage actually increases the likelihood of them actually going to a doctor for both preventative checkups as well as when something's wrong, okay? But the fourth reason, and the one that's Trump is now impacting, is because of medical innovations. The US has had more medical innovations, and specifically around cancer, than pretty much anywhere else. We have been a powerhouse for discovering medical breakthroughs that save people's lives. And Medicare specifically is very generous when it comes to covering medical innovation. Our taxpayer dollars literally go to saving people's lives in the form of Medicare, but also in the form of grants and funding the NIH, the National Institute of Health. They have developed tons of new ways to detect and treat cancer. In fact, since the early 90s, the US mortality rate was cut by a third. Any new cure for cancer will be prioritized for American patients, okay? We get the newest medical innovations first. It's all going to change now, because now the NIH is getting decimated. There's been $180 million in National Cancer Institute grants that have been canceled. Hundreds of staff have been terminated by the National Cancer Institute, including dozens of communications workers, which I'm going to go into in a second why that's so important. Also, Trump has proposed that the new budget for the National Institute of Health be cut by 40%. That's going to have an immediate impact on whether people live or die. So among the people who lost their jobs were most of the workers inside of the National Cancer Institute's communications office. Those workers were responsible for disseminating really important health information. And that included information that is found on cancer.gov, which is a website that is widely used by cancer patients so they can be updated on the best resources at how to survive cancer. Also, doctors and clinicians who care for cancer patients and save their lives, they rely on up-to-date information, right? The fact that those resources are now not going to be updated because most of the workers were fired, that will have an immediate impact on cancer patients who are looking for information about treatments and research to help inform their care. One scientist said that people will die because there are life-saving efforts that are literally being curtailed at this moment. Even though the USA still has better cancer survival rates compared to Europe, it's still the nation's second leading cause of death. Only heart disease surpasses it. 618,000 Americans are projected to die of cancer this year, and that number is now most likely going to rise because of the budget cuts and all of the grants that have been eliminated by the Trump administration. One study predicted that those budget cuts will also shorten Americans' lives by 0.24 years per person over the next 25 years. So earlier this year, doctors at the National Institute of Health made a really promising step in the fight against cancer, announcing an immunotherapy treatment that was able to shrink gastrointestinal tumors for about a quarter of its patients. That's huge. But since Trump's massive layoffs and cuts, that rollout of this new treatment is now being prevented. Like that big rollout is being delayed indefinitely, right? In a population of more than 340 million people, this now reflects 82 million fewer years of life, okay? Economists will use various methods to estimate the value of life, and typically they find that years of life are valued at roughly $100,000 to $200,000 per year. Even if we use that lower valuation, this means that all of the cuts happening at the National Institute of Health will translate into more than $8.2 trillion. Okay? These losses, we could compare those against the gains that emerge from reduced public spending, which is what the Trump administration says that they're doing, right? So let's compare those. Over 25 years, the proposed annual savings of these $20 billion in cuts to the NIH, that amounts to $500 billion total, okay, in total budget savings. However, this pales in comparison to the $8.2 trillion in lost health due to the cuts, okay? That is 16 times greater than the proposed cost savings. Put another way, punishing campuses by cutting health research funding would destroy the equivalent of 1/4 of the annual gross domestic product, GDP, here in the United States. So the one thing that the US was beating Europe in, well, Europe's finally going to beat us.